Well, hi, my name is Dr. Christopher Cannon. I'm a professor of medicine at Harvard Medical School and a practicing cardiologist at Brigham and Women's Hospital in Boston. I'm also executive director of cardiometabolic trials at the Harvard Clinical Research Institute. And I co-chair CardioCare Live, which is a virtual congress program. I've been involved with CardioCare Live since 2010 and co-chair the program with Dr. Roger Blumenthal from Johns Hopkins and Dr. Clyde Yancey from Northwestern's Feinberg School of Medicine. And I recently co-chaired an atrial fibrillation virtual summit program that was conducted in CardioCare Live in September of 2012, and we'll be hearing a little bit more about that today. And so in my short talk, I wanted to introduce you to the CardioCare Virtual Congress platform and show you how it works and offer some of my perspectives as both a researcher and academician and a practicing cardiologist. So CardioCare Live was first launched in 2009, and it has now spun into 12 different similar congresses across different therapeutic educational areas. And so what CardioCare Live offers, and this is our illustration for this platform, is that it offers clinicians and industry a credible environment that's similar to a live congress, such as, for me, the American College of Cardiology and the American Heart Association. But it's presented entirely online, and as such offers really a unique interactive format that provides live video presentations. And then these are soon thereafter available on demand. And there are top cardiovascular disease opinion leaders and lecturers from around the world who are all together in a single online event. And as such, it really does mimic a live program. And so this platform offers this live event, and also the other part of a live thing is an exhibit hall. And so it has a virtual exhibit hall and resource centers that practicing clinicians can visit. And so between the two, you get accredited CME activities as well as non-accredited industry-sponsored activities. So CardioCare Live is therapeutically focused, and we run virtual congresses and events across a wide variety of topics that are important in cardiovascular disease. And this has included lipids management, atrial fibrillation, as we'll get into in this particular program, also acute coronary syndromes, heart failures, obesity, and many more. Now, the size of these events typically ranges from 1,500 to 2,500, primarily US-based clinicians. And the majority tend to be specialists, certainly for CardioCare Live in cardiology, but also internists who are interested in cardiology in particular. So what is it from the clinician's perspective? Well, I think CardioCare Live provides physicians access really to the latest science that's presented by some of the most respected thought leaders that can talk about their specialty areas. And in CardioCare Live, they actually engage in live questions with the faculty by interacting through both polling questions and live case presentations. And so they will be able to type in questions that then can be asked directly to the presenter during the talk. And so they really gain information and perspectives that they can use. They have a question on their mind, they ask the speaker, what about this or what about that? And so this really becomes a back and forth. And of course, on demand, later you can watch other people's questions and then always go back to it and look at the reference material that's presented. And of course, this can happen from home or office, and the viewers don't have to travel to a location for such a congress.